Cool.
All right, so take off that resistance band there. Abby and Andrew, do you guys have any patients with neck issues right now?
Yeah, one of mine is actually.
Yeah, one. Yeah,
I don't
we do.
have any now.
Okay, and what's the scenario for them?
For my patient, it's interesting. So they came into the clinic. I had them for an eval. They had like sensations running throughout their body. But ever since they came in, they haven't really had any problems. But what
Yeah.
we've been trying to do is we've been trying to work on like some cervical muscle tightness. I'm trying to regain some range of motion, and I
Okay.
will also work on the thoracic.
Yeah, they got mobility, range deficits for sure.
Okay.
The symptoms she was coming in for, we haven't really been able to recreate or reproduce. And since she started PT, she hasn't really had them at all. She's just super stiff and limited. So
I told you guys, Mike Palmer is magic. So yeah, so if she has some tightness, some stiffness, then these exercises I'm about to show you could be helpful for her if you guys wanted to try them out. So the first thing is rotation range of motion. And this is, commonly the complaint for someone with a stiff neck is I can't turn as far as I want to when I'm driving, etc. So Andrew, what you do is you'll just turn your head left and right. And Abby, you're looking to see, is that platform sliding back and forth? If his head is moving, but the platform's not, they're not doing it correctly. So Andrew is doing a great job. The platform is moving side to side, and that means that his head is staying in the same place. And so that's pure rotation. So that looks really good. So what's nice about this is it's in a non-weight bearing position, right? So gravity is eliminated. So Mike, I hate giving out snags or something like that in seated because firstly, I feel like it's uncomfortable. They're wrapping a towel around their neck and gravity's impacting their spine. So I feel like patients have found this a lot more comfortable, especially if they have neck pain and you're asking them to go to an end range position.
yeah, also with snags, like they just get so confused on hand placement and how to do them. This seems way simpler.
Yeah.
It's definitely simpler. Yeah. And then if you did want to do some overpressure, you can just have the patient or you push the platform a little bit once they get to end range. So Andrew, turn all the way to the left.
Yeah, Abby, you want to try pushing that?
And then you can just glide the board a little bit further
No,
the other way. Yeah. Or Andrew can do it. So you can have the patient do it independently. And that'll just give them a little bit of extra stretch.
Nice.
So that's easy. So I'll do that for like a few minutes for a patient. Like I'll say, all right, just start turning, going for 2 minutes. And, after a minute or so, they say they can feel their neck relaxing, etc. So that's a nice place to start. And I'll do that before I do any of the strengthening exercises as well, because the patient understands what this device does. Okay.
Very cool.
Any questions with that one?
No, it's pretty easy.
Okay. And then you can also do side bending if you want to improve their lateral flexion. So you could put the board on a little bit of an angle. So it's like going up towards one shoulder higher than the other. Yeah. And so for this scenario, Andrew would be side bending left. So he'll go from center to left. And then Abby, don't let him turn his neck at all. So keep his head and face up to the sky the whole time. So Mike, I've had some PTs start doing this motion with nerve glides. And so they'll have, like, for example, here they'd have the right arm doing a median nerve glide, for example.
Okay, cool.
And the form, I'll be critical here. We have to keep the head right up to the ceiling. So it's pure lateral flexion. Yeah, there you go.
Just like this.
Yeah.
Yeah, good job.
And don't rotate. Just keep your head so you get that true side bend.
Yeah.
This.
Yeah. Rotating to the right a little bit now.
Yeah.
Yeah. All right. So those are the two range of motion ones that I'll do a lot with my patients. So let's go into the strength exercises.
Cool.
And Andrew, you're just going to throw on that headband. The Velcro is going to go in the front, and the black side is on the outside. Put the Velcro on the other side.
Velcro in the front.
Oh.
So bring that towards your back. Yep.
I see. Yeah.
There you go.
And then put that sucker on pretty tight. And Abby, you can put on the yellow band. There you go. All right. So we put on the headband because otherwise your hair is just going to slip on that board when you're trying to get some grip. So now that we have some grip, Andrew, you're going to start turning your head left and right, that same exercise we were doing first, and you're going to make that platform slide. So here we're, of course, strengthening the neck rotators. Mike, I ran the math on this. I checked every single cervical muscle, and it looks like 60% have a role in rotation.
Oh yeah,
Isn't that crazy?
that is crazy.
So it's like 11 of 18 are neck rotators. So really you can't miss if you're doing a rotation exercise like this. So that's the first strengthening exercise I'll usually do with the patient. I'll usually cue them for a little bit of a chin tuck to get the deep neck flexors involved.
Can we try a higher resistance?
Oh yeah.
Yeah. So you can see what it feels like. Let's go to green.
Oh, Mike's brutal.
Good. You feel the difference?
Oh yeah.
Nice. Cool. All right, you can relax.
Okay, so then obviously, Mike, we do a lot of isometric holds at the UD clinic, and
Yep.
we do that a lot in sitting with a TheraBand around the head or using the hands. So here's an alternative in supine. Put on the yellow band again. And Andrew, what you're going to do, you're going to lift your head in the air and then slide the board to one side with your hand.
So like this.
Yeah, and then slide it all the way over. Good, and then come down. And then gently let go.
Like this.
Yeah, and then your goal is to keep your head in neutral. So the isometric hold, meaning you're not going to move your head at all.
Don't let the board move.
Oh, I see.
Yeah.
All the muscles are kicking on there.
Very
so that
cool.
wants to side bend you to the left, and it wants to rotate you to the right. And so you're using all the muscles to counteract that force.
Very cool.
Can you feel it?
Yeah, you said it's hard.
So for some patients, that is very challenging. And I'll do a half slide instead of the full slide that you guys just did there. Okay. So I'll do like a 10-second hold for patients in the clinic. And you can, of course, do that on both sides.
Very cool.
All right. So you can reset there. And then you can slide it to the other side. I'll show you another exercise.
Got it.
Good. Come down. Now you're going to let the board turn you to the left. Good. So here's eccentric rotation. And then, Andrew, you'll just come back up to tall to center. There you go. So this is only working on the right rotators.
Yep.
How's that one feel, Andrew?
It's good.
Very cool.
And then you can do, so I'll rep out like 2 sets of 10 in both directions for a patient for this one. And then probably the most challenging one that I'll give out is lateral flexor eccentric. So that same position that you're in, Andrew, now you're going to let the board side bend you to the right. So Abby, use your hands and just guide him through this motion. So keep his head right up to the sky and then bend him right. There you go. And then Andrew, you got to get back to neutral. Very good.
Yep.
So that's working on the left lateral flexors.
Cool.
So really you can't miss. If you want to work on a specific muscle group, you'll be able to hit it. You know, we got the lateral flexors, we got the rotators, and then I was going to show you guys the chin tucks if we have time. Mike, do we have time?
Yeah, let's do it.
All right. So Andrew, you can sit up.
I got it.
And then we're going to tilt the head of the table up a little bit, just like 10 or 20 degrees. There you go. And then you're going to rotate the device so it's parallel to the spine now. Can you spin it the other way so we can see the bands? Thank you. All right, Andrew. So your head's going to go at the very bottom of that.
Yeah.
And then, yep. And so rule of thumb here, your shoulders shouldn't be touching the device, which looks like you're good. Just the head is supported. So that looks excellent. Go ahead and take off the yellow band. I'll just show you flexion, extension, range of motion.
Yeah.
So Andrew, you can go into extension. So look back towards those windows and then down into a chin tuck. So this is what I call like the perfect chin tuck, because the patient really can't mess up the chin tuck motion as long as that board is sliding.
Yeah.
So Abby or Andrew, have you guys given out chin tucks to a patient yet?
Yeah.
So did they do it right correctly immediately?
They never do.
No.
So yeah, this is a reasonable way to get them going on it because it's really hard to mess up. Like Andrew, try to not do a good chin tuck.
I don't know
What's
how
going to happen is the board won't move.
He doesn't know how to do a bad one.
Exactly. Look at that. Yeah.
Just too good.
I paid Andrew like $20 to say that there. So that's good for flexion extension. And then of course you can put on the resistance band and then we'll do resisted chin tucks. Okay, so now lift your head up and slide the board away from you a little bit. That's going to put a little bit of tension in the band that we want. So lift your head up and just slide it away just an inch, just the platform part. So not the whole device.
Just this part.
Yeah, there you go. That just puts a little bit of tension through that band that we want. And then Andrew, you're going to do the same thing. So do your chin tuck. There you go.
Yeah, a little bit of resistance to it. Just do the chin tuck. You don't have to do the extension. There you go.
What do you think, Mike?
This is awesome.
Yeah.
This is brilliant, man.
I don't know about brilliant, but
This is brilliant. You engineered this.
I've had a lot of help, my friend. A lot of help.
Yeah. This is your idea though, man. That's how'd you come up with this?
I hated snags so much. I hated putting resistance bands around people's heads. I just couldn't stand any of that stuff, man. It just felt so stupid.
This is so cool.
So the other thing you can do, and real quick, is just throw on the green or the blue band, and I'll show you. You can just do a real quick, gentle traction. Like say your patient's already in this position, or you want to know if they'll respond to traction. Andrew, you're going to lift your head up and pull the board towards you. Sorry, again, just the sliding part.
Just sliding part. There you go.
There you go. And then come down. And then just let go. And that's a gentle traction.
Yeah, I feel it.
That's cool.
So, I mean, obviously the setup's probably a little bit quicker than the mechanical traction you guys have there in the background. But this would not provide the same level of force, and it's harder to cycle back and forth and be as specific as we can.
But still, I mean, it's pretty amazing what all the things you can do with this device. There's a lot of stuff.
Well, thank you so much for the time. It was great seeing you guys.
Yeah, man.
Yeah, thank you for showing us.
Thanks for your time, and thanks for this
Thank you.
awesome.
Yeah, of course.
Love the name too.
Oh, thanks, man. Thanks. And then if you guys are on Instagram, follow at NecksLevel.
Oh, you got IG? All right.
Oh yeah, I've got IG. Yeah.
You on all the social medias?
IG and TikTok.
All right, nice.
Yeah.
Very cool.
All
Awesome,
right,
man.
guys. Thank you for your time.
Thank you.
Yeah, thank you, Scott.
Bye.
Thank you.
Yep.